Let's talk about Propecia. Propecia, otherwise known as Finasteride. There is a medication that was developed in the early 90s, primarily as a treatment for men. It works by decreasing the amount of the hormone dihydrotestosterone, aka DHT, in the body. Finasteride works by stopping the natural conversion of testosterone into the more potent androgen in individuals genetically prone to hair loss. DHT affects hair follicles, reducing their size and causing thinning until the following, he eventually dies, leaving the person with bald spots. Because finasteride stops the process that hurts testosterone into DHT, it helps to prevent and also reverse thinning. Finasteride is especially useful when it's taken in the early stages, evolving when hair follicles have just started to shrink. Finasteride can only be used in adult men, since DHT is an important hormone responsible for the development of secondary male characteristics, such as facial hair, deep voice, and body hair. Using finasteride as a teenager could interfere with puberty. So have you used finasteride? Usually, finasteride is taken in the pill once per day. When you take finasteride is up to you, but in general it's advised to be taken in the morning. When testosterone levels peak, it can take around 3 to 6 months to notice a change from finasteride, similar to most other hair treatments. Furthermore, it's important to remember that if you want to maintain your hair growth, you must continue taking it. Sadly, once you stop taking finasteride, your hair loss will continue. Now, the real question is, if finasteride is such an effective pill, why doesn't everyone with hair loss take it? The truth is that finasteride can cause side effects, and this makes sense because it has a substantial impact on hormone. Studies have proven that erectile dysfunction, loss of libido, and the development of man boobs are all side effects that can occur from finasteride use. Although adverse side effects aren't as common as many people say, there is always a risk when you're taking a medication that directly affects essential sex hormones. Another severe side effect is finasteride can have an effect on a growing fetus. Finasteride is extremely dangerous to pregnant women and can alter the development of an unborn child, potentially causing abnormalities in the genitalia of a male fetus. There's also a risk that finasteride can be carried by semen and then affect the development of a growing child. For this reason, some men choose to stop taking the medication when trying to continue. See if you're looking for an alternative to taking finasteride that is still proven and backed by clinical trials. Then I would recommend our laser therapy hair growth solution. So does finasteride work? Yes, clinical studies have proven that it really does work. However, there's always a risk of side effects, and it's really up to you to weigh the pros and cons.